Hi, everyone. My name is Lakshmi Aldridge, and I'm the current president of the Society of Dermatology Nurse Practitioners. And I'm delighted to welcome you to our February webinar. Tonight, we're especially excited because not only are you going to hear from an excellent speaker, but she's also a dear friend of mine. I'm delighted to introduce Paula Bermann, who is going to be talking with us about dermatology NP certification and recertification, really providing you with all of the information that you need to know. Paula Bermann received her Master's of Science in Nurse Practitioner at Graceland University, and she received her MSN also at Georgia Southern University, and her postmaster's at Graceland University. Her dermatology experience spans 30 years as both an RN and an NP in dermatology practice. She is the immediate past president of the Dermatology Nurse Practitioner Certification Board and is a member of the SDNP, the DNA, and the AANP. She participated in the creation of several absolutely pivotal DermNP milestones, including the scope and standards of practice, the dermatology nurse practitioner competencies, and most recently, and probably the most pivotal, the national accreditation awarded to the DCNP credential and exam, which was many, many years in the works. And thanks to her leadership, was able to achieve this. She's recently retired and works part-time or as needed in private practice and also volunteers at a local indigent clinic. She is probably one of the biggest advocate for dermatology NP certification. She is a wealth of information in all things related to dermatology, and she truly is a wonderful mentor and colleague. So I'm delighted to introduce Paula Bermann. Take it away, Paula.
As Lakshmi said, I'm here to talk about the Dermatology Certified Nurse Practitioner exam, and as well as talk about the Dermatology Nurse Practitioner Certification Board. And I thought I'd start out by showing you what the agenda looks like for tonight. We're going to talk about the exam history, the exam itself, study guides, review courses. We'll talk about recertification. We'll talk about the recent accreditation that the board and the exam and the credential received. I'll show you some statistics of the DCNP, and then we'll take some questions and answers. So let's look at the history first. In the early 1990s, a group of dermatology RNs and NPs got together and formed the Dermatology Nurse Certification Board. That board was started with some seed money from the DNA, although it was separately incorporated. And that's kind of like a myth we've been trying to dispel, that neither the Dermatology Nurse Certification Board nor the Dermatology Nurse Practitioner Certification Board has ever been a part of the DNA. Without the DNA, neither one would have existed because of the seed money they gave us, but always separately incorporated. And that's going to be important as far as review courses and that are concerned. The first exam that the DNCB wrote was quite a milestone for derm nurses, as it took years and years of preparation for it. A practice analysis had to be done. It not only was for RNs, but at the time it was for nurse practitioners too, because it was the only certification exam for dermatology nurses of any kind. It was given twice a year at the DNA convention. And as I already stated, many NPs sat for the exam because it was the only certification exam that had to do with dermatology nursing at all. And finally, after years of discussion, a group of nurse practitioners that were part of DNA got together and decided that we needed our own exam, we needed our own board. The board would take years to develop, but the exam was just a little bit easier to develop. And maybe some of you that are on the call tonight can remember how for many years, groups of NPs would sit around at the DNA conventions as part of the NP focus groups and talk about the need for a nurse practitioner exam, something specific to advanced practice nursing, and also to have our own board. And lo and behold, in 2005, a practice analysis was mailed out to all members of the Nurse Practitioner Society of DNA. The practice analysis was used to figure out exactly what did dermatology nurse practitioner practice entail in the early 2000s at that time, because obviously if we're going to form an exam, we need to know what do nurse practitioners actually do. No one had ever really surveyed that until the practice analysis went out. So the first pilot exam was developed out of that practice analysis, and it was administered as part of the DNA convention in Orlando, Florida in 2007. And I can remember walking out of that exam and thinking, oh my God, if I really treat all these diagnoses, I deserve a raise. And that kind of gave me the impetus to go back to work. And it didn't work out for me as far as getting a raise was concerned, but I figured it was worth a try. So after the pilot exam was administered, it was psychometrically analyzed by our testing organization, who is CNET. Some of you might be familiar with CNET. CNET stands for the Center for Nursing Education and Testing. And CNET has been with us from the beginning and still is our testing organization. So that's who you send your application to when you want to sit for the exam. It was a paper and pencil exam for the longest time, simply because we didn't have enough numbers in order to pay for the exam to be transitioned to computer-based testing. Of course, now it is, but it took us a few years to get enough numbers in order to make that financially viable for us. There were no review courses at the time, so we couldn't develop a review course because of the conflict of interest that the Dermatology Nurse Practitioner Board would have as far as developing a review course. For years, people asked for a review course from us, but we had to explain we couldn't do it. We had to wait for another organization to do it, even though we knew one was needed, and we encouraged other organizations to come up with a review course. Now, in 2014, we finally were able to split into two separate boards. We identified the fact that we needed to have a board that was strictly nurse practitioners, not a combination of RNs and dermatology nurse practitioners. So in 2014, we split to form two separate boards. The Dermatology Nursing Certification Board kept the RNs, and the DNC, the Dermatology Nurse Certified exam. We split into the DNPCB, and of course, for the nurse practitioners, and our credential, as you know, is the DCNP. Our board is composed of 5 directors. There's a list of our board members. Right now, we have a vacancy that we will fill at the end of February as part of the DNA convention. Some of you might have seen a call go out for the vacancy, and we got some wonderful candidates, and we had a hard time choosing one to fill the current vacancy that we have. We also have a public member, and the other thing I wanted you to know was we have a management company. Our management company is DRI. Kelly Tiffany, some of you might have talked to Kelly. She's our association manager, and we have our testing company that I already talked about, the Center for Nursing Education and Testing, or CNET, who's been with us, gosh, for what, like 30, 40 years now. So let's talk about the exam itself. There's 175 multiple choice questions, including photographs. As I mentioned previously, the original the exam was developed after a practice analysis. That was when we did the pilot test. And since then, every 3 years or so, we do a practice analysis. The most recent one was done in 2019. And perhaps some of you might have participated in that recent practice analysis. It went out to by email to all the DCNPs. It went out by email to all of the members of the DNA Nurse Practitioner Society. And I personally posted it on the AANP Specialty Practice Group Dermatology Forum that has about 700 members. So hopefully when you saw that email, you were a part of that practice analysis. And I'd like to encourage you also, we'll have another practice analysis going out in a year or two. When you see that email, please open it up and answer the questions on it, because it's really important for all of us to know, not just for the exam, but for the different associations to know exactly what does dermatology nurse practitioner practice look like, for instance, in 2019 or in 2024. To keep the exam current, a psychometric analysis is done every 3 years, and we do item writing every 3 years. And what item writing consists of is we go ahead and we look at the exam, examine every single question. The next slide will tell you a little bit more about it. And I'm happy to say that finally in 2020, we were able to get our exam on computer. We had enough numbers that it was financially viable to do that. So now people are able to take the DCNP exam in their own neighborhood. There we go. So let's talk about the exam eligibility. You must have the master's or a doctoral degree in nursing. You have to, of course, have current NP state licensure. You have to be nationally certified as a nurse practitioner, such as a family nurse practitioner, adult, geriatric, pediatric. And this is an important point as well. You must have a minimum of 3,000 hours of recent dermatology nurse practitioner practice within the last 3 years. You must be currently practicing in dermatology. In other words, hours spent as an RN in a dermatology office or clinic doesn't count. We only count the numbers, since this is a nurse practitioner examination. We expect the hours that you're submitting to us to be NP hours in dermatology. And then, of course, hours obtained from a formal dermatology nurse practitioner academic program count towards those 300 hours. And formal dermatology NP academic programs include such as those up at Case Western, University of Rochester, Leahy Clinic up in the Northeast, and the Florida Atlantic University down in West Palm Beach. Those are all formal dermatology NP academic programs, and those certainly count. So we talked about what the exam is. Let's talk about what it's not. It's not a certificate or a certificate program. There are a couple of those out there. We're not that same thing. It's not an entry into practice exam, such as the FNP, the ANP, the PNP exams are. You must have the 3,000 hours before you can sit for the exam. It's also not for NPs practicing only in wound care or aesthetics. There's other certifications for those particular specialties. And finally, it's not for the primary care nurse practitioner who's treating acne, AD, warts, that sort of thing. It's strictly for nurse practitioners who are practicing in general dermatology. So let's take a look at the exam content. We have a blueprint on our website, the dnpcb.org, and we include all the patient problems that are being tested. And this is a list of all the patient problems. Please don't write these down. They're all on the website. Not only do we let you know what the patient problems are, but we also break down the patient problem areas so you can really concentrate on what to study. Let's look at the first patient problem, which is neoplasms. On our website, you'll see the detail that under neoplasms, these are the things that we're going to be looking for you to answer on the exam. Things like AKs, BCCs, melanomas, KAs, sebcares, squamous cells, that sort of thing. So we, contrary to some people's public opinions, we really want people to pass this exam. So we don't want to make it easy, but we want to let you know what we're going to be testing you on. Now, let's look at the positive and look at what happens after you're certified. After you pass your exam, we will send you a personal account number via email when we find out that you're certified. We use a free app called CE Broker that tracks your continuing education credits over the 3-year certification period. What you do is you upload your continuing education award certificates as you earn them, and the CE Broker tracks the type of CE credits as you enter them, whether they're CME or whether they're contact hours, and we'll talk about that in just a minute. I found CE Broker particularly helpful because I don't know about you, but when it came to me at the end of the 3-year period, I'd be scrambling all over my office trying to find out, where are my certificates? Do I have enough? Do I have enough hours in order to recertify? That sort of thing. So this is something that you can do as you go along, and it makes it so much easier to go ahead and put in your recertification application after 3 years is up. A word about the review courses. There are now 3 review courses available. The first one was the DNA Nurse Practitioner Society came up with a virtual online review course. It can be found on dnanurse.org. The second review course that was developed is from the Center for Advanced Practice Dermatology. Their website right now is under renovation, shall we say. So Margaret Bermann, one of the founders of the review course, has let me list her email. So if anybody has any questions about that, please get in touch with her. They have an in-person review course in the fall, and they also have a virtual option as well. And then finally, the SDNP, which you all know about since you're here tonight, they will have their first ever review course in April as part of the convention in Nashville. And information on that can be found at dermnp.org. But I did want to say this, that before the review courses came out, over 100 of us were somehow able to pass the exam without a review course. How did we do this? We studied our textbooks. We studied Habif. We studied Fitzpatrick. We studied Bologna. And somehow with the blueprint and with our textbooks, we were able to pass the exam. So I'm saying this because just in case you cannot get to a review course, or you don't have the money for a review course, or you don't have the means for a review course, you can pass the exam by studying your textbooks. So I just wanted to leave that option open to people. So now that we've talked about certification, let's talk a little bit about recertification. As we already said, the credential, the DCNP credential, is valid for 3 years. It always expires on December 31st of the 3rd year, no matter when you sat for the exam. So if you took it in January, or you took it in August, or you took it in December, it would always expire on December 31st of the 3rd year. There's 2 ways to recertify. You can recertify by exam, or you can certify by continuing education credits. Something very important is, if you're going to recertify by continuing education, instead of taking the exam again, the content that you submit must be derm related or derm specific. Remember, this is a specialty certification. This isn't your FNP or your ANP or your GNP or PNP. This is derm specific. So naturally, the content should be derm related or derm specific. Oh my God. I don't know how I got this, but
if you use if you just scroll your first button,
I'm good. Okay. So let's talk about, thank you so much, DJ. Thank you for sticking with me here.
No problem. Just so you know, though, your slides are not up. So just so you know, I only see you right now. I don't know if we're supposed to be.
Oh no, what happened?
I'm not sure. You might have stopped your screen share by mistake. If you go to that bottom again, if you see that green share screen button on the bottom of your Zoom.
Yeah, I have no share screen.
What are you seeing on your end right now?
I'm seeing my slide.
Okay. Minimize that real quick, the actual slide.
Okay.
And then do you see the Zoom box? Do you see like the squares and everything?
I don't think I'm able to minimize my slide.
Right click on your slide.
Okay,
And once you right click, a white square should pop up. And then at the bottom, you should see end show.
right click and show, got it.
Okay. And
Okay.
then you see
Go to
Zoom.
Zoom.
Yep.
Can you see me?
Yeah, I now just see you. Yep. And then on the bottom of the page, you'll see that green share screen button.
I never see green share screen button.
From your Zoom account.
I'm looking. I see a nice picture of blonde hair.
Yeah, that is our boss. Yeah, because this is her account. But if you just move your cursor around, do you then see a bar pop up at the bottom? If you just move your cursor around in Zoom.
I don't know that I'm in Zoom. Share screen.
Got it. There you go. And then your slide should pop up again as an option. There you go. And then you could just click, yeah, from current slide.
I got it. Please don't put this on my evaluation.
No, you're all good. Just click on the from current slide.
I'm here.
And then it's probably just loading. Yep, there you go. Now we got it on our end.
Let's talk about it.
Yeah.
So in order
All
to
good.
recertify, am I good?
All good. You're perfect. Go ahead.
In order to recertify by continuing education, as we said, you need a minimum of 60 continuing education credits. A maximum of 30 of those continuing education, 60 credits can be CME. There's a reason for that, and we'll go over that in just a minute. Of course, all content, once again, must be Derm related. And when you upload the certificates into CE Broker, you must specify who the accrediting body was and the number and types of credit awarded. And we'll go over that in detail in just a second. There's 5 categories of continuing education that we recognize. So let's look at the most popular one, which is category A, or dermatology, CE credits, minimum of 60. And there's 2 types. The first type is contact hours. The second type is CME. What's the difference? Contact hours are awarded by a nursing accrediting body after a nursing review. And those nurses obviously use the nursing model of care that we used, that we were trained under, that we were educated under. CME credits are awarded by a physician accrediting body after a physician and/or PA review. They use the medical model of care. So let me tell you why the DNPCB requires a maximum of 30 CME. We recognize that as nurse practitioners, we were educated using the nursing model of care. Therefore, we believe that we should practice under that model. Therefore, only 30 CME are accepted for recertification, and the rest of them should be contact hours awarded by a nursing accrediting body such as ANCC, AANP, California Board of Nursing, any of the nursing accrediting bodies. I can't tell you, doing the 35 recertification reviews that I had to do in the past couple of months, I must have had to explain that so many times. And I was surprised to learn that so many DCNPs didn't realize there was a difference between contact hours and CMEs. But it's such an important distinction. That's why we require a maximum of 30 CME. We'd love to see you have all 60 be contact hours, but we understand that some quality programs only offer CME, so that's why the 30. I also wanted to point out that there's a new trend that's been out for a couple of years now. And that new trend is some of the accrediting bodies are joining together and coming up with interprofessional continuing education. And this is one of the largest bodies that has interprofessional continuing education. I'm going to read to you what they say about that, because I thought it kind of like really summed it up as far as how everybody's going to the team approach for care. It says the Joint Accreditation for Interprofessional Continuing Education offers organizations the opportunity to be simultaneously accredited to provide continuing education for multiple professions through a single unified application process, fee structure, and set of accreditation standards. Joint accreditation is the first and only program in the world offering this benefit. It offers organizations the opportunity to be simultaneously accredited to provide continuing education for athletic trainers, dentists, dietitians, nurses, NPs, optometrists, PAs, pharmacists, physicians, psychologists, and social workers through a single unified application process. This is the important part. It requires that the planning process must include professionals who are reflective of the target audience, in our case, nurse practitioners. So even though it's jointly accredited, it still goes through review by nurse practitioners, and that's the important part. And the certificate given upon completing any of the programs, whether you go through ANCC or AMA PRA for CMEs, it will state which type of credits you're being awarded, such as CME or CH, contact hours. So let's go on to the other categories. Category B is academic credit courses. Again, must apply to dermatology NP practice. Therefore, courses such as leadership, professional develop, they may apply to your primary certification, but they're not dermatology specific. And we are a specialty certification. And of course, we only accept them from accredited educational institutions. Category C is professional publications. Once again, content must be relevant to dermatology. It's got to be published in a recognized professional journal, newsletter, booklet, flyer, something like that. Maybe an article, maybe a book chapter, research paper, etc. And the breakdown of how many contact hours you get for each one is listed on our website. Category D for recertification includes Derm presentations. And you can present to peers, other healthcare professionals, lay people. If you do the same presentation 5 times, you only get contact hour credit for the initial presentation. Of course, it's got to be a dermatology program. And the breakdown is a 60-minute presentation earns you 1 contact hour. Category E is the DCNP exam review and item writing. And we already talked about how we try and update the exam every few years in order to keep it relevant and in current practice. And every 3 years, we have volunteers that meet for a 2-day meeting to review the exam. A psychometric analysis is performed before that meeting by CNET, our testing agency. New questions are written, old questions are discarded, and this is kind of a timely presentation because in about 12 days, there'll be a 2-day in-person meeting in Las Vegas, immediately preceding the DNA convention. And we have a panel of 4 DCNPs that will sit for 2 days with every current textbook known to man for dermatology and the psychometric analysis of the exam and look over each and every question to see which are still relevant, which need to be new, written new, that sort of thing. And people that volunteer are awarded 8 contact hours. We'll be doing this again in a few years, as I already mentioned, and I hope those of you who are DCNPs already or will be by that time will look for the call for item writers. It's a terrific experience. I've done it a few times. I'll be doing it in Las Vegas. It's a wonderful time to not only take a look at the exam again, but also you learn so much because we have nurse practitioners in different specialties, pediatrics, surgical, aesthetics that will be joining us to help with the item writing. I did want to mention a word about precepting. We've had a couple of requests from people asking if we would accept preceptor hours. Up till now, we haven't, but we'll be talking about that as a board this year. So if you're a preceptor, watch for an email once we decide how to address the precepting contact hour issue. I'd also like to announce that we had some great news last year that finally our board, our exam, your DCNP credential is accredited by the Accreditation Board for Specialty Nursing Certification. I'll read to you what the ABNSC actually is. It says the ABSNC accreditation is a peer-reviewed mechanism that allows nursing certifying organizations to obtain program accreditation by demonstrating compliance with the highest quality standards in the industry. Currently, it accredits 60 nursing specialty organizations. Some people have asked us, why in the heck did it take like 5 years in order to get this accreditation going? Well, unfortunately, our profession needed a professional makeover. We needed up-to-date scope and standards of practice. We had to develop some current nursing competencies, and I shouldn't even really say current because up till now we haven't had any nursing competencies. And we also had to do another practice analysis to make sure that we were reflecting current practice. And to get all these documents and professional accomplishments done, it took a collaborative effort between the DNA, the SDNP, the AANP, and the DNPCB. So all of those groups came together and came up with the scope and standards, the competencies, and the practice analysis. And I'd like to also make sure that those of you who do hold the DCNP credential, that you let your malpractice carrier know that you are credentialed in your specialty, because many malpractice carriers now discount your premium because you are credentialed in your specialty. Now let's take a look at some DCNP statistics. You can see that for the last 3 years, we've had a slight drop off in people who have taken the exam. In 2019, you can see we had 102 nurse practitioners take the exam. 2021, we had 69 take the exam. We jokingly thought, God, is it the review classes? Are they scaring people off? We don't know. But then we thought, well, it was the initial impetus and for the 102 when the first review course came out, a lot of people jumped on the bandwagon. And now that it's kind of died down a little bit, we're hoping that the numbers will go up in the future. And we're sure they will with this new SDNP review course that's going to be presented in April. If you go over to the middle of this graph, it shows that our pass-fail rate averages 77%. According to our testing organization, CNET, they tell us that that's exactly where we want it to be. We don't want the exam to be too easy. We don't want the exam to be too hard. If it's too easy, then it's not recognized as a true measure of excellence in dermatology nurse practitioner practice. So we're happy with 77%. We do see that we have a recertification rate towards the right side of the graph of 84%. We see that happening as some of us are reaching retirement age. Some people have left the specialty, so we're content with the 84%. We'd like that a little higher, but again, we know that the average age of nurses in the country in general is kind of up there, shall we say. So recertification rate stands right now at 84%. And the last column, the one in yellow, shows that right now, if you are a DCNP, you have 405 peers out there around the country that are also DCNPs. So with that, I'll be happy to take any questions and answers. And again, please forgive me for not, this is the first Zoom meeting that I've ever been a presenter at. So I'm not the best at this, even though hours of practice and a new computer to boot. But anyway, thank you so much for allowing me to present this important presentation tonight.
Thank you so much, Paula. You did absolutely great. We do have some questions for you. The first question is from Angelique. What can you submit as proof of completion of your 3,000 hours?
Well, on the application to sit for the exam, you list your employment for the last 5 years. And we try to assume that if you've been employed in dermatology for at least 2 of the last 5 years, you've reached that 3,000 hours if you indicated that you had full-time employment. So it's really nothing that you really have to submit. It's on your application. If your application isn't clear, then CNET will ask for further documentation, maybe from your employer, but that's a rarity.
Thank you for that. Another couple of questions. We can see that some people might be a little bit reluctant to take the exam. When taking the exam, and if you're unsuccessful, God forbid, how soon can you retake the exam? And how many times a year can you retest or take the exam?
Well, again, another rarity, but I believe CNET set the timeline of 6 months, that you must wait 6 months before you can take the exam again. I don't know that we've ever had anybody have to take it more than twice. So I don't know after that 6 months, if you fail twice, I'm not sure. I'd have to check with CNET, and I'll be happy to put that on the Facebook page for the SDNP if that information is needed. But I hate that negative thinking, you know, of that people think, oh my gosh, I'm not going to pass it the first time, the second time. So you got to think positive, people. You got to think positive here.
Thank you. I loved what you had to say, Paula, about at least over 100 of you took the exam without any kind of review courses or any kind of resources other than that blueprint and our old textbooks. So that is reassuring. Lindsay was kind enough to say thank you. You did a great job. Lauren asks, are there any study resources that are strictly practice questions? And I can answer that first off by just saying that the SDNP is offering solely a practice test question session, and that is on May 7th. And you can sign up for that on the SDNP website. But Paula, I will ask you to answer that question with other information you may have. So the question again is, any other resources that are strictly practice questions?
You know, yes, the SDNP, obviously, and then the Center for Advanced Practice Dermatology this fall will have a practice to pass in-person and virtual option, where I believe it's like a full 8-hour day. They go over practice questions and also test-taking strategies.
And Peggy Vernon made the comment, Paula, thank you for your excellent presentation, for clarification of recertification, and especially for your expertise and experience. Another question, how long do most people study or prepare for the test? Can we still apply to take the test year-round?
Yes. You can take the test year-round. We haven't heard any difference. We switched to year-round testing because of the pandemic. And we're hoping that if the numbers stay up, we'll be able to keep offering the exam at neighborhood, like in Savannah, it's done. I'm in Savannah, Georgia, by the way. It's done at the Royce Learning Center. So if you have like a Royce or one of those other type of computer centers in your community, that's where they're given. The other part of the question, Lakshi, was giving it year-round.
I think that was it. Just was
Okay.
Yeah, I think that was the only.
Oh,
question.
I know what it was, Lakshi. It was a studying. How long do people study?
Oh, that's right. Yes.
Right.
Sorry.
Okay. You know, it's individual, you know, it's very individualized. You know, somebody who's been in dermatology for 15 years probably isn't going to need to study as much as someone who just reached the 3,000 hour threshold. So it's really, you know, and the fact that the blueprint tells you everything that's on the exam, you can look at that and see, gosh, I've done a ton of AKs. I can recognize one. I can recognize a SebCare, 2 checkout counters away at Walmart. If you have that type of, a background, you're probably not going to need to study as much as someone who's brand new. So I really can't answer that question. It's really individualized.
Thank you for that. Annette has a question. Do you anticipate in the future insurance companies such as Medicare requiring certification in order to be reimbursed for services? Excellent question.
Yeah, that is an excellent question. And we'd sure like to see that happen. Us being accredited by the ABSNC was certainly a step in the right direction towards helping that to happen. So again, it's probably going to end up being a political thing, but we know that insurance companies, once they're giving us discounts on malpractice premiums, that was such a big step to have. So all I can say is time will tell as far as Medicare and Medicaid are concerned.
I think the other side of that answer is there any downside to being certified? And I think the answer is no. And I think that one of the concerns that I have is if suddenly Medicare or other insurance companies make the decision that they are going to reimburse using rates differently for board certified individuals versus not, that then you're scrambling to suddenly get certified. So why not have that under your belt, and then you can feel confident if and when those changes happen. So
great point.
Just my 2 cents. Melissa, I see your email to Paula, and I will send that to her. Lindsay, I'm enrolled in the seminar in Nashville, she says, and also the May review. Thank you. When should I send in an application for the exam? Early May. So Paula, the timing between certification review course, practice test question, when should she mail in her application for the exam?
Well, that's also a good question. Gosh, these questions have been great tonight. Again, it's kind of individualized. I've heard some people say, well, it's still fresh in your mind. Well, you have finished, 16 hours of intensive review. It's probably a good idea to sit for the exam immediately afterward, in which case, if you're planning to take the exam as soon as you finish the review course, you probably want to send in your application tonight, because that review course is the end of April, and it's going to take a while for your application to, our testing company has to verify your nurse practitioner certification, has to verify your state license, that sort of thing. So it takes a little bit of time. So now if you want to, take some time for the review course to gel and to bone up on things, and you're not going to take it maybe for 6 or 12 weeks after the review course is over, then send your application on the day you leave for the review course.
So her clarifying question was, is the application only good for 30 days?
No.
So once you send in the application, how long is that valid before you have to take the exam? Or does that expire?
Now, maybe what they're talking about is the permit to take the exam. Because once you're approved, once CNET has verified all your credentials and verified your application, and they send you a permit, CNET gives you 90 days to sit for the exam. If in your neighborhood, if you don't sit within those 90 days, you'll have to talk to CNET, whether they'll extend it for you or not.
So once you send in your application, the application is reviewed, and then you are issued a permit authorizing you that you're certified, you're qualified to sit for the exam.
Right, and then you make an appointment. You make an appointment at your testing center, so that you just don't walk in there with the permit and say, hey, I'm here, So you make an appointment with the testing center, and then on that day you show up with your permit.
So the permit is good for 90 days.
I'm pretty sure it's 90 days.
Great. Wendy wants to know, what are some other arguments in favor of getting board certified? I'm trying to make a case to the county health department for which I work to support this process.
Well, I think the literature is full of arguments towards certification. You know, I know on the ANCC website, there is a great rationale for being certified. Perhaps we should put something like that on our website. I'm not sure that there's not one, come to think of it. I think I might have written something on our website that says it's good to be recertified and this is why. I mean, to be certified and this is why. So I'll have to check that. And if I didn't write something, I will and put it on there, but I'm pretty sure there's something on our website. But I would say check the ANCC website because they have a great full page article. I think it's even referenced from a journal that touts the benefits of certification.
There is also a very excellent article, several articles in the Journal of Dermatology Nurses Association, JDNA, touting the value of certification. I think the best argument, from my humble opinion, is that when we look at our colleagues, dermatologists, all of them must be board certified. And certification is a measure to the public, to our patients, to insurance companies, and basically to any person who is scrutinizing your practice. Certification is really the highest level of demonstrating, next to licensure, that you are qualified and that you are an expert in your area of practice. So I really think that if we are saying as dermatology nurse practitioners, we are qualified to sit at the healthcare table with our other professional colleagues, including dermatologists, pharmacists, and other professionals who are also required to be certified, that this is a measure of putting us at that table with the commiserate credentials. That would be my argument. And again, I always say, what's the downside? I have a fear factor issue, so I always never want to be left scrambling at the last minute. So that is what I would say. But many of my colleagues who have been dermatology certified for many, many years have written great articles, and also on the SDNP website under certification, Catherine Hoover has done a beautiful video, and I believe that there is also a link to Paula's article, which she wrote in The Dermatologist several years ago. So there are many resources for that argument, but I truly think, especially as a county health department, I'm sure that their physicians are certified. In fact, it's a requirement for them. So there you go.
Great.
A couple of other questions. Paula, you're very, very popular, which we knew that. Let's see. Peggy made the comment that now that the exam has national accreditation, which again this is a legit certification exam. It is the gold standard for dermatology and NP practice. So great point, Peggy. There's another question. Is there a lot of focus on pathology, or is the focus on clinical dermatology?
Well, again, you know, looking at the blueprint, showing everything, of course, there's some pathology. For instance, you know, I'm not sure if this is on the exam, but if it was, I would expect, for instance, under melanoma, you're going to want to know the pathology of a melanoma. You're going to want to know level, migration, that sort of thing, you know. So yeah, there's some pathology on the exam. Absolutely, as we should know for our practice.
Great, thank you. Amy wants to know, can you tell us again where we go to apply or gain more information about the certification exam, Paula?
DNPCB.org.
DNPC FNP-BC.org. And there's
Correct.
also a link from the SDNP website.
And from the DNA website.
I also wanted to ask you, Paula, regarding recertification. So, once we take this test, we're all terrified of having to take it again. I don't know why, but so recertification is really important. And as you mentioned, the certification is good for 3 years, and the expiration is on December 31st of that 3rd year. How are we notified of the timing to recertify?
I'm glad you brought that up. I had that on my notes and I forgot to mention it. About 6 months before you're due to recertify, we send you an email. And the email lets you know that your certification is expiring at the end of the year. And we have a deadline of October 31st for you to get all of your information into CE Broker so that if we have any questions for you, we've got the month of November and December to get things straightened out, because we never want anybody's credential to expire while we still have questions about it. So, but about 6 months, about June or so, an email will go out. Now, there is a caveat to that, though, that even though we will send an email out, it is still the certificant's responsibility to keep track of when their certification expires. So if for some reason you missed the email, or you didn't update your email address with us, like we found out so many people don't update their email address with the certification board, and so the email is returned. It's still the certificant's responsibility to know when their credential expires.
I literally put as soon as I received my certification, I fast forwarded on my Outlook calendar for 3 years, walked back 6 months and put an appointment in there to recertify or fill in the application. I don't know what people did before Zoom or before Outlook calendars and everything else. I also sent a note to all of my friends and family to remind me as well in 6 months. Just kidding. A couple of other questions. I want to invite Peggy Vernon. I know that you're on. I hope you're still on. I just wanted to introduce Peggy Vernon, who is the chair of the review course for the SDNP, to share just a little bit of information about the review course for any of you who are interested in further information. Peggy, would you like to speak to that? If you're able to unmute yourself.
Just give me 1 second on my end, because she's technically an attendee and not a panelist. So I would have to promote her to a panelist, but I could still do that. It would just give me 2 seconds.
Nope, DJ, that's fine. I can go ahead and speak to it.
Okay.
And then if you want to go ahead and do that, then Peggy can jump in. So when we created the review course, we literally took that blueprint that Paula has mentioned, and the entire review course breaks down that blueprint, and you will not only be able to be fully immersed in each section of that blueprint, but then when you go to the review course, you will have lectures breaking down that review course even further and doing highlights of the sections about what you need to know to take the exam. And then finally, the live practice test question session will again be based on the breakdown of the priorities on that blueprint. So it is not just some random review course that just tries to give you all the information about all things dermatology, but it really is based on the criteria of the blueprint that is directed by the DCNP. And thank God they give us that blueprint, because it really is exactly that. And that's what you need to study in order to take the exam.
Lakshmi, I'm on.
Perfect, Peggy, take it away. Please,
I didn't hear your last
Peggy
statement.
Vernon.
I would just like to say that we take the DNP, CB patient problem list, and we address every single one of those topics. And it's extensive, it's sometimes daunting, but the 2-day course with the 4 presenters will address every single one of those topics And we will give you examples based on percentages. You will have a nice study guide, both a slide deck and a study guide to be shared. So it will closely follow the recommendations of the board. And then the practice study questions on May the 7th will be remote. And that is to help relieve any test anxiety. I, for one, am a terrible test taker. And having something like this to relieve that stress of having to take a test was really helpful to me. And so we'll be presenting that independently. The certification review course is worth 16.5 CEs that will apply to your recertification. And the practice study questions will also give you 4 CEs to be applied. So right there, you've got 20 credits to be applied to your recertification. And right there, that's worth it in 2 separate courses that will have certificates.
Peggy, I need to maybe clarify that, because I'm assuming that the people that take the review course have not yet been certified, right?
They have not. That is correct.
Okay, so in order for those hours to count, they would have to already have been certified.
For
Right.
recertification, correct. But those hours count towards your
Towards
NP primary
FNP,
certification.
right, exactly.
Okay.
Peggy, Lauren did have a question. Can we sign up for only the May 7th practice question session if we can't attend the in-person review course?
I have gotten so many questions about this, and the answer is yes, you can. And what you do is go to the page where it advertises the certification review course, click on that, and then on that application, you can choose to go to the symposium only, to the review course only, to the practice test question only, or you can go to all 3. So that's the page you need to go to sign up for the practice test questions.
Great, thank you. I also just wanted to, will the review course be available virtually?
Our hope is that it will be within the next 6 months. We don't have that finalized yet, but we are working on having that within the next 6 months.
And then Laura wants to ask, when do we have to sign up by for the conference and the review course?
Well, you can literally sign up for it the day before. We do have a cap on the numbers. We had to reserve a room, so they will only hold so many numbers, and it's filling up pretty quickly. And we hope after tonight, it will be almost completely full. So my suggestion to you is get your registration in so you have a seat at the table. For the practice test question, that will be remote. And Lakshmi, I'm not sure if there's a cap on those numbers or not. You'll have to address that.
No, I think that we'll have a little bit more flexibility with the virtual practice test question session. But I would echo Peggy's comment that sign up early and sign up often. Just kidding. The earlier you can do that, the more secure you will to have the seat. The other point too is that for the review course, you will be getting a course book ahead of time, an electronic course book. And so that you want to have time to review prior to coming to the session.
And I'd also like to say that we are going to have 3 pharmaceutical sponsored talks for your meals. So if you go to the review course, you'll get breakfast every day, you'll get lunch both days, and you'll get dinner on Sunday evening. So that will help relieve some of your expenses as well.
Nice.
Paula, do you have any final thoughts?
No, I loved all the questions. I tried to think of as many questions as I could when I was preparing the presentation, but those were really great. So I really appreciate the opportunity. And And, you know, our association manager, Kelly Tiffany, like I mentioned, her information is on our website, is there, you know, 5 days a week to answer questions. If she can't, she'll get a hold of me or Megan Ferguson, our president. And so I just really appreciate the opportunity tonight from the SDNP to present this, because the more of us that get certified, the better for our profession.
Thank you so much, Paula. And Peggy, any thoughts from you?
No, I just reiterate what Paula just said. I think that this is going to become the gold standard, not only for employment, but to negotiate your raises in the future. It's going to help you secure your jobs or change your jobs. And I do hope that insurance companies will pay attention to this certification accreditation. And I in my heart, truly believe that this will become the gold standard to practice as a dermatology nurse practitioner. I think in the future, if you're not certified, it's going to minimize your clinical competence. And this is going to accentuate to your peers, to your colleagues, to your employers, insurance companies, and to your patients that you have achieved this clinical competence.
Thank you so much for that, Peggy. And then a final thought that I would have, just personal perspective, is that, you know, a lot of people have test anxiety. And I know that I was one of them, and I didn't become certified until just about 4 years ago, after being bullied by Paula into doing it. And there was no review course then. And I literally had the books out and the blueprint and studied and did just fine. We all have passed 2 exams already. We have passed our NCLEX, yes, go back way when we all sat for our nursing exams and you all passed. We sat for our NP certification exam and passed it. And God knows that was all things, not just one focus area, but it was all things, and you passed it. So this is not a big deal. We can all do this. And so put away your test anxiety. Nothing is going to happen if you don't pass. So there's always that. And you always have the opportunity to take it again. Worst case scenario. But I have every confidence looking at those pass rates that we will all do just fine. So please think back on your own successes and achievements. You're a great dermatology nurse practitioner and you passed 2 big exams already. You've got this in the bag. And we at SDNP, that really is our mission, is to support and encourage and do everything we can to help dermatology NPs achieve certification. That is one of our missions. And so we really hope that you will take advantage of all of the review courses by the SDNP, of course, but also DNA and CAPD, whatever it takes for you to become certified. We really want to encourage you to do so. So again, Paula, thank you so much, first of all, for providing this excellent lecture this evening, but for your many, many years of service on the Dermatology Certification Review Board, your leadership for getting the milestone achievement of getting the exam accredited, which was that final pinnacle that we needed, and for all you've done for us as dermatology NPs. So we're very grateful. And with that, I again want to just share with you the information about the review course. Please go to dermnp.org for any information further that you need. And also for the, there's a link there for the Dermatology Certification Review Board, where you can access further information about the blueprint, the certification exam application, and any other questions that you may have. Thank you so much for being with us this evening. Stay safe, healthy, and thanks for all you do for your patients and for the profession. Have a good evening.